Hi everyone, this is Dr. Rabinovich of Dental Muse. This day and age, the sleep industry is a multi-million-dollar industry. They're trying to sell you expensive mattresses and pillows and gadgets to help you sleep better. But you actually can take just a few easy, cheap steps in order to improve your sleep tremendously. So here are 5 tips from a dentist to a good night's sleep. Tip number 1. Good breathing is good sleeping, primarily nasal breathing. Studies have showed that nasal breathing as opposed to mouth breathing lowers stress and anxiety. So all the more reason to keep your nasal passages clean and able to breathe. Also, this is where our filtration system is located. So you need to filter that air and humidify it. So the way to do that is nasal irrigation. Practice good nasal hygiene. You want to irrigate with salt water. You can add some other additives to it, but the primary reason for it is to wash away the allergens, wash away the pollutants, and able to breathe better. Tip number 2, keep your mouth shut. So for the same reason as in tip number 1, you want to breathe through your nose. When you open your mouth, you're not actually filtering the air. You're breathing in unfiltered air. You're drying out the saliva. That leads to more cavities and also gum inflammation. And also when you open your mouth, all the soft tissue just obstructs the airway even more so. And the way to do that, mouth taping. You can buy really cheap medical paper tape at any pharmacy and use a small strip to keep your lips together. So I use it diagonally. It still allows me to breathe through my mouth if I absolutely need to, but it also trains my body to keep my mouth shut. Tip number 3, know the symptoms of sleep disordered breathing. If you grind your teeth, if you snore, if you wake up gasping for air, if you wake up in the morning with a headache or super tired, if you rely on caffeine a lot to keep you going, if you experience daytime sleepiness or inability to focus, chances are you have some level of sleep disordered breathing. It's not always sleep apnea, but you can have fragmented sleep even if you don't have sleep apnea. So all the more reason to speak to your airway conscious dentist or your primary care physician about it. Tip number 4, when in doubt, figure it out. There are really easy home sleep tests that you can take. And again, speak to your primary care physician or airway conscious dentist for a home sleep test. The goal is to get at least 2 nights of sleep. The more data you collect, the better, because one night could be an outlier and you won't know it. And finally, tip number 5, get to the root cause of things. If you grind your teeth and you keep breaking them, if you don't sleep well, figure out what's causing it. If it is in fact sleep disordered breathing or sleep apnea, you have options. The CPAP machine is considered to be the gold standard in the medical community, but many people cannot tolerate it, in which case an oral appliance is a really great option. Oral appliance has been FDA approved to treat mild and moderate cases of sleep apnea or sleep disordered breathing, and actually severe cases as well, in cases where patients cannot tolerate a CPAP machine. So if you have any questions, please reach out. We're Dental Muse, and happy sleeping.